So, good afternoon, everyone. So, my name is Peter Haven, and I am the Executive Director for the Bahamas Anti Doping Commission. And along with me, I have Mrs. Lael Johnson, who is our Office Administrator. And I also have Dr. Symonette and Dr. Goud, who are both members of our team. So, we will get started tonight. First, I would like to introduce Dr. Symonette, who is a board member for the Bahamas Anti Doping Commission, who will be speaking on nutrition today. So Dr. Symonette is a native of Nassau, Bahamas, and she received her high school education from St. Augustine's College, graduating in 1970. She attended Howard University in Washington, D.C. on a full athletic scholarship, where she received a double major in zoology and physical education. She remained at Howard University to complete her Master's of Science in Exercise Physiology and also obtained her PhD in Nutritional Science. In 2002, Dr. Symonette was appointed to serve as a board member for the Bahamas Anti-Doping Commission. So in addition to all of her roles in the sporting community and health and nutrition in the Bahamas, Dr. Symonette is an international DCO, a certified nutrition specialist, and an exercise physiologist. She's also been a doping control officer at the 2016 Rio Olympics. So Dr. Symonette, you can take it away.
Thank you so much. Good afternoon to everybody. And we're going to get started in the interest of time. We know it's a few minutes, but we were just making sure we had everything in order. So now at the bottom, there we go. So I'm going to be talking about optimizing nutrition to maximize performance. And I want to just start off by looking at what some of our objectives are. And those objectives, one, to help you understand and recognize the key nutrients in sports nutrition. So, every nutrient is important to the body, but some are of particular interest in sports nutrition. Objective 2 is to understand the role of cellular nutrition in sports performance. And then thirdly, the recovery strategies for sports performance. And then just share and discuss some simple steps to optimizing post-workout nutrition. So just by way of introduction and taking us into, laying the foundation for this, athletes really do care about their performance, whether we're talking about endurance or speed or strength, power, precision, focus, all of those components that come together to help an athlete excel. And athletes push themselves to their physical and mental limits. So it's important to understand for athletes in particular and coaches that it's the cells in our bodies that propel us towards our goals as athletes. So keeping that in mind, we feed ourselves food, but the food, we extract nutrients from it. So it's an athlete's micronutrient requirements that help really feed and power the cells, but they may fluctuate widely depending on the intensity and duration of training. So that means that the cells must be nourished to tap peak athletic performance. And through my experience, what I've learned is that even with an excellent diet, deficiencies often exist simply because remember that the micronutrient requirements vary, and depending on where you are at the time, for young athletes who need to consider not only performance, but growth as well, sometimes athletes just don't meet those needs. But when cells perform optimally, meaning that they are absorbing the nutrients, metabolizing them, repairing and building tissue, the athlete will not only feel better, but perform better. So the thing that's interesting is that most athletes recognize the importance of what we call macronutrients as opposed to micronutrients. So the macronutrients would be like protein, carbs, and fats, and you would hear athletes all the time talking about how much protein they need, how much carbs they need, and they want to control their fat intake because they don't want to gain weight. But the micronutrients are often the ones that are overlooked. So the micronutrients, we'll look at that based on the sports, what I call the sports nutrition wheel. I took this from SpectraCell, but these would be specific nutrients. For example, if we look at magnesium, magnesium is key to the production of adenosine triphosphate, which is ATP. That's the body's main storage form of energy. So supplementation may improve aerobic performance and muscle strength and repair. And I'll mention supplementation a little bit long because we know that's a hot topic for athletes, particularly with the risk of anti-doping. But I can tell you from my experience as a doping control officer, both at the Pan Am Games and the Olympic Games and IAAF international relays held here in the Bahamas, the majority of athletes take some type of supplements. And so we know the caution is always to be careful, and you do have to be careful, but there are ways that we can check to find out whether supplements are safe to take. Another nutrient, for example, and I won't go through all of these, is CoQ10 or coenzyme Q10. And this helps mitigate or diminish muscle damage after high intensity training. And studies indicate that there are benefits both from a strength and endurance perspective with CoQ10, and 300 milligrams of CoQ10 increased power in Olympic athletes, and there are references cited for this. So most athletes in the general population might know about like magnesium or zinc or B vitamins, vitamin D. Some of these are hot topics now because of COVID, vitamin E, vitamin C. But some of the other nutrients like carnitine and glutamine and cysteine, which reduces time to fatigue in endurance sports, like if we were considering cycling or marathoners or even soccer. Soccer is an endurance sport. These nutrients would reduce time to fatigue. And so they work together. Some of them serve as cofactors for certain, to have certain effects on the body. So they don't just exist in a vacuum. They work together. So as a athlete who may be involved in a team sport, you could appreciate how important it is for the team to work together. And the same is true of these nutrients in the body. So how does cellular nutrition maximize your performance? So this is objective 2. And we'll look at each of these individually and try not to spend too much time on them. But 1, it accelerates muscle recovery. And that's critical for athletes, particularly if you have multiple events in a day, or you're playing in a basketball tournament, a round robin volleyball, or even back-to-back high intensity events, one in the evening, one the next morning. So muscle recovery is very important. Also boosting cellular energy to minimize oxidative stress, so damage to tissues and cells. Micronutrients also improve mental focus and protects from brain injury. And we've seen this in studies using particularly DHA, which is one of the omega-3 fatty acids, and also strengthens immunity and hormone regulation. So looking at them individually, in terms of muscle recovery, we'll see that vitamin C and carnitine reduces post-exercise muscle soreness and minimizes muscle damage. Dr. Goud and I have worked together quite a bit with Bahamas Football Association, soccer. And when we're reviewing labs, for example, you might see blood markers that are not of real clinical significance, at least meaning that the athlete's life is not at risk, but they're certainly of significance when it comes to performance, because it speaks to muscle recovery. It speaks to dehydration issues. So it's really important from that perspective. So asparagine and carnitine also delay muscle fatigue by improving endurance, and folic acid or folate improves smooth muscle function. So that's how some of the nutrients accelerate muscle recovery. In terms of boosting cellular energy, it's important to understand that inside every cell in our body, there's an energy storehouse called a mitochondrion. And the primary function of that storehouse or the mitochondrion is to generate energy. But mitochondria needs really large amounts of micronutrients to power muscles and nerves and heart. So a single deficiency can compromise the way mitochondria fuel muscles, and this would lead to decreased endurance and strength. And I remember one of our athletes who I guess about 3 months out from Carifta, training hard, but just hit the wall. I mean, just could not go any further. And so her parents brought her to me, and we did a micronutrient test to see where she might be lacking in nutrients. Micronutrients, we checked like 34 micronutrients. And well, long story short, the athlete ended up winning the gold at Carifta that year. So that was just a 3-month turnaround to try to get this athlete where the recovery was, she was having good recovery and doing what she was supposed to do. So vitamin A helps maintain cellular equilibrium when the energy ramps up. So, you know, the body is always seeking to be in a state of balance or equilibrium. And B vitamins directly impact the energy pathways in the mitochondria. I found even outside of the athletic population, when, you know, the average person is always fatigued or they're like weekend warriors or exercising, the greatest impact I see in terms of their energy is when they're on a good B complex supplement. Because remember, B's and C's are water soluble, so they're not stored in muscle tissue to any degree. The body uses what it needs, and then the rest you just excrete. Vitamin E, which protects ATP. And if you remember from the earlier slide, the energy, ATP is the energy currency of our bodies, and vitamin E protects that. And then carnitine, lipoic acid, CoQ10, they serve as critical cofactors for mitochondrial function. So they help support the mitochondria. So looking at minimizing oxidative stress, we understand that when an athlete is training at an intense level, it generates a substantial amount of oxidative stress. So maximizing antioxidant in athletes is critical to help heal post-workout tissue and cellular damage. So that's what we look at in terms of oxidative stress. So think of it as oxidation. You cut an apple, you leave it on the table, it's exposed to air, it gets too much air, it turns brown, it rusts. That's the process. So you have this process of oxidation, and we need antioxidants so that we prevent or minimize this post-workout tissue and cellular damage. So vitamin C and cysteine helps prevent exercise-induced damage to cells. And again, vitamin E protects the cell membranes during strenuous exercise and reduces the number of damaging compounds in the blood. So we're not going into the mechanistics of all of this, mechanisms, because we just don't have time for that. But this is all scientific studies, research, peer review stuff. So mental focus and brain injury protection. I mentioned earlier that DHA, which is a type of essential omega-3 fatty acids, as opposed to EPA. So you have EPA and DHA. But DHA, which is also present in mother's breast milk, is what stimulates the growth of healthy neuronal tissue in response to injury, which protects against concussion. So you can think of sports where athletes might be at greater risk of concussion, like soccer and football, rugby, those kinds of sports. You know, so it's important to understand an athlete's risk and the kind of protocol they should be on to minimize some of the damage. Studies show that omega-3 fatty acids can also improve lung capacity, reaction time, and mood in athletes. So in terms of mood, it's definitely DHA. The EPA is more critical, like for body composition and those things. So immunity and hormone regulations. So moderate exercise is associated with improved glutamine function, but when athletes are on exhaustive training programs, it can induce a glutamine deficiency, which could result in the athlete being immunocompromised or having decreased immunity. And nutrients also affect hormone levels. When we think of like cortisol, which is the stress hormone, so serine and these amino acids decreases post-exercise cortisol levels, reduce muscle soreness, minimizes psychological depression that often accompanies overtraining. And I think that's a part of training and recovery that sometimes we, as part of the athlete's entourage, don't pay enough attention to, that overtraining could have psychological effects on the athletes, and that coupled with micronutrient deficiencies just exacerbates that problem. So what are some of the recovery strategies for sports performance? So we agree, we understand that athletes train hard to prepare and perform successfully. And unfortunately, the performance benefits gained from including recovery strategies within their daily programs are often ignored or forgotten. So when athletes do not plan to recover properly, all the hard work that they're putting in, they're not in a position where that training benefits them optimally, because their recovery program is not what it ought to be or not even in place. So recovery is really one of the basic principles of training. And we have it serves two primary roles. One, it helps us monitor the athlete's adaptation to training and stress, so that appropriate recovery strategies can be determined. If we're not monitoring an athlete's adaptation to training and stress, we will miss those opportunities to identify where the athlete needs the most support, okay, the greatest support or most help. And then two, the selection of specific recovery techniques and strategies to minimize any residual fatigue from training and competing. And a lot of times when I'm talking to athletes, whether they're cyclists or marathoners, my question, soccer players, for them is always, if you're training every day, do you feel the same on Friday as you did on Monday at the beginning of the week? And if you are feeling more fatigue and less energetic as the week goes on, that's definitely an indication that your recovery program needs some work. So what is the focus of recovery? The focus of recovery is to get athletes well prepared for the next training or competition event. I mean, it's as simple as that. But the goals are to replace muscle and liver glycogen stores. Remember, muscle glycogen is where energy is stored, but muscles they have a limited capacity to store glycogen. And that's why the recovery process in terms of replacing fluid, electrolytes, carbohydrates, protein, it's important to know that. So the focus should also be on fluid and electrolytes lost in sweat, and then repair the damage caused by exercise. And keep in mind that timing is critical. Recovery will be most effective immediately after and during the first few hours after exercise. So immediately after exercise, and then during the first few hours after exercise. And this is even more important when there is another event, let's say in less than 8 hours, because as I said earlier, if you're competing back to back, you want to be able to recover, because if you can only do well the first half, but not the second half, you're going to lose the game. It's like basketball or soccer or any sport where you can't finish. So how do we monitor those adaptive responses? What variables should we be looking at or monitoring? So it's important, and this is a good strategy for athletes, is to just have a diary, a training diary or a logbook, which would enable you to learn how to evaluate your stress level and your adaptive responses, okay? Because we don't always feel the same every day. And you know that if you're using a training diary or a logbook and you have a training schedule for 2 hours on Monday, and then you have a different training on Tuesday and maybe something different on Wednesday, you're doing plyometrics or whatever, you would be able to go back to that and reference that and say, okay, based on my training diary or logbook, I felt on what we call rating of perceived exertion on a scale of 1 to 10, where 10 is the most fatigue you could feel, like exhausted, you just can't go anymore. You can rate your training based on your perceived exertion level. So that's learning how to recognize how you feel, and that's a really important skill. When we look at how you're feeling, one of the best things for athletes for recovery is sleep, the quality of sleep. And I'll explain that a little bit later. When you get up in the morning, what is your resting heart rate? Now, there's a lot of technology now where before this might have been more difficult for athletes to monitor, but there are all kind of apps and sports devices, watches where you could monitor resting heart rate. I mean, I can tell you every morning what my sleep was and what my heart rate was during sleep, because it's something I still monitor. But this area seems to be the greatest areas of inconsistency in athletes. Also, make it a habit of looking at your morning body weight. And why is that important? Because if your morning weight, if you're always, your weight is always less in the morning, it could be because of body fluid loss, which means that should be replaced, because one of the biggest challenges, again, is dehydration, which could significantly impact aerobic capacity. And then, like I said, the daily rating of fatigue levels based on what we call RPE, or rating of perceived exertion. So another recovery strategy is how do we manage it? So we have 4 generic types of training and competition fatigue. So we have metabolic fatigue, which is looking at energy stores in the body, glycogen storage. We have neural fatigue. So this would be peripheral nervous system, the extremities, the arm, the legs, or localized force production. And then central nervous system, which is your motivation, your drive, your determination. And then there's also psychological fatigue. So emotional and social stress factors could cause psychological fatigue. And then we have environmental fatigue. So environmental fatigue would be climate. What climatic conditions are you training in? Is it extremely hot outside? What's the temperature? Are you training up at mountain level, sea level? All of that makes a difference. And then travel. Excuse me. So in terms of travel, even our Olympic athletes, how many different time zones will they be crossing? How does that affect their recovery, their performance? So the challenge is to recognize the type of fatigue and then select specific strategies to reduce and minimize this fatigue as soon as possible after the training or competition. So there are 3 major specialty areas to consider when designing appropriate recover strategies. So one is nutrition, of course. So that's why I said checking your body weight in the morning, because monitoring fluid loss is essential. A loss of body weight of 2% or more, even during exercise, will result in a reduction of aerobic output. Okay, so if an athlete becomes excessively dehydrated, this could lead to overheating, which can be dangerous, but their aerobic capacity then can be reduced by up to 6%. So you're not in a position where you could take in and utilize oxygen as efficiently as possible. Adequate supplies of glycogen in the muscle and liver are needed to support the energy demands and promote recovery. I don't give specific guidelines here because this varies and differs from athlete to athlete. So when I'm working with athletes and I'm trying to guide them in terms of their recovery strategy, looking at muscle glycogen stores, carbs intake, it's based on grams per kilogram of body weight. So if I'm giving all athletes the same template, obviously it's not going to be effective or beneficial. But we do know there are some general guidelines. So small amount of protein intake with carbs before, during, and after hard training are recommended to help minimize muscle protein breakdown. So in the past, people would just do, Gatorade, or any sports drink. But the research evidence is pretty convincing and pretty strong that when you combine protein with carbs before, during, and after hard training or competition, um, the recovery process is more efficient and you minimize muscle protein breakdown. But keep in mind that the type of protein depends on whether it is before, how long before, how many hours before. So during would be the type of protein, because you would want something that has maybe some liquid, a little bit of powder. You don't want 3 ounces of steak during a competition just to say you're combining protein with carbs. Okay, so all of that becomes important. And then after is also timing. So all of this is really, the timing is really important. The other recovery strategy we look at is physical therapies. And we look at physical therapy in terms of rest. So we have passive rest, which is sleep. And that's one of the most important forms of recovery any athlete can have. And we're looking around 6 to 7 hours of sleep a night. If we're looking at younger athletes, remember that they might need a little more sleep, because we all have to always consider the age population that we're working with, because younger athletes, they need calories and sleep for growth, and they're in school and they need academic performance. And so again, you can see the benefit of having all of this individualized. But one thing we do know, studies have shown us that too much sleep could be detrimental to performance, because it could slow down the central nervous system and lead to increased levels of melatonin. And we know what melatonin does. It's going to leave the athlete feeling kind of slow and lethargic. I can relate to that, because I survive very, very well on average of 6 hours of sleep a night, 7 most. But if I get the 8, 9 hours of sleep or more, I feel like somebody just beat me real bad, and I'm not ready to run. And then we have active rest. So we have passive rest, which is sleep, and then we have active rest. And this type of recovery strategy, active rest, is really undervalued by not only athletes, but also coaches. But this helps to recover the physiological state. So this would be like a light jog or a walk or a swim. That helps with the physiological state, or a cycle to recover the lactate system, minimize muscle soreness. And you see this with a lot of, when they do post-match, particularly in some of the Grand Slam events or like tennis, you see the athletes, they will go into the gym and they will start cycling just to help recover the lactate system. Or light jostling, like you shaking your arms and legs, the shaking the muscles groups to recover from neural fatigue, okay? And remember that rest days are essential. Some athletes think that they need to just overtrain, train, and that again is not the approach, because we know overtraining can result in depression for some athletes. So try to carve out at least 1 day a week where you have a non-training day. And you use that time, just socialize, spend time with your family and do other things, so that you take a mental break. That's important, to have 1 day of rest. And then there are hydrotherapies. And hydrotherapies, like spas and hot water tub and those kinds of things. Here we have the biggest, most beautiful one, the ocean. But there's some research done that demonstrated that underwater massaging, like the jets in a spa, following plyometric type training, they help athletes to maintain leg explosiveness on the following day. And by contrast, when you have passive rest after such training, it resulted in a significant reduction in leg power. So this would be definitely important when you consider track athletes, soccer players, footballers, rugby players, any type of sport where it relies on leg explosiveness, even basketball, volleyball, you know? I mean, you don't need leg explosiveness in golf or archery or those kinds of things, but you do need it in quite a number of sports. And then sports massage. So the evidence on sports massage is mixed. It's more of a physical and psychological relaxation for the athletes. So the muscles, you know, they feel relaxed. But in terms of performance enhancing therapy or recovery strategy, there's some mixed information out there. So in the third area, the last one is psychological skills. So there are four main psychological strategies that are used to enhance recovery. And we've all experienced some of these as athletes. Debriefing. Every time after a game or a match, we huddle in the locker room or on the field, and the coach might do a debriefing. You know, that's the time when we evaluate performance, how we did as a team, how we did as an individual, and the coach might, you know, just give some advice. And that provides both emotional and psychological recovery for the athletes, you know, to just understand what happened, particularly if the team lost. Then we look at emotional recovery. So the debriefing, then now emotional recovery or some kind of contingency planning. And this is useful in handling emotionally traumatic events. And the most recent one that I can think of was when the UK played Italy for the Euro Cup in soccer just a couple of days ago. I think it was Sunday. At the end of regulation and double overtime, the score was tied and they had to do a shootout, and Italy won by 3-2. And you could see the British fans were so devastated, they started beating up the fans from Italy, and then all kind of racist remarks started coming out. So, you know, imagine the three young men from the UK who missed the goal. So that's like a traumatic experience for them when you put that in the midst of all the racist comments and all of the other thing that's going on with the fans from the UK. And this is where mental toughness skills comes in. And so it's important to teach athletes how to have positive self-talk and develop a positive body language. If you're an opponent, you could sometimes pick up on when athletes, particularly their body language. If an athlete is coming over as not being very confident, that's the person you're going to pick on. I mean, I play tennis, I do it in tennis. But you can, if you don't have that mental toughness and develop those mental toughness skills, then you become a target, but your performance then suffers as well. And so the final one in terms of psychological skills is relaxation techniques. So that could be meditation, PMR, which is progressive muscle relaxation. And that's very easy to learn and do. Visualization, breathing exercises, music, anything that helps you relax. It's important to be able to identify, strategize, and then use that to help as a forms of recovery. So this is our last objective here. So this is steps to optimize post-workout nutrition, and I just kept it kind of very simple, just some ideas. So we got to plan for success. Athletes need to get as much knowledge as they can and plan to succeed. Athletes train hard, they train well, they want to succeed, but they don't always plan for success. And as simple as, you know, bringing your own supplies to the venue, to training, sometimes to competition. You know, if you have special needs, you need to be responsible for that. Don't rely on competition venues. And this is always a challenge for me coming from a nutrition background. When I look at our competition venues and I see what's being offered for athletes. If you look at the swim complex, if you look at the athletic stadium and athletics, I mean, if athletes don't bring their own supplies, they end up eating kung fritters and hot dogs and deep fried chicken and French fries. That's not a good plan for success. And then we have to teach athletes, and athletes need to learn how to make appropriate food choices. And I mentioned earlier about the protein and carbohydrates. So the general rule of thumb is 2 grams of carb to every 1 gram of protein. And then it's usually an intake between 50 grams to 100 grams of carbohydrate is adequate to restart that fueling process. But that fueling process, timing is critical. So there's a critical window. So improving the timing of food intake post-workout, what is that critical window? And I always tell athletes within the first 30 minutes, try to start this recovery process where you're looking at, it could be something as simple as a protein bar, where you're looking at, 1 or 2 bars that has 25, 30 grams of protein in it based on body weight, or it could be a protein shake. I mean, they have shaker bottles now where you can put the powder at the bottom, and then when you're ready for it, just put it in the liquid and drink it. So a liquid recovery drink of 0.8 grams per kilogram of body weight of carbs and 0.4 gram per kilogram of body weight of protein immediately after training is important. And that's like I say, within the first 20 to 30 minutes. And then about an hour later, if the training was really hard and intense, you could repeat that same thing. But I would say up to 1 to 2 hours post training is when you really want to have your meals, where you focus on getting your main meal, your recovery carbs. And this could improve muscle glycogen recovery by at least 20% based on the scientific research. When you miss this critical window of opportunity, you don't optimize your muscle glycogen recovery, okay? So the body is most receptive to fluid, carbs, and other recovery nutrients immediately after training and competition. So in performance, nutrition matters. And it is unfortunate that most athletes never know how much better they could be if they took better care of their nutrition. So nutrition is the key. And this is just a minute video, because when we talk about supplements, as anti-dopers, we're big on anti-doping. So this is by informedchoice.org. And this just explains how you know if your nutritional supplements are contaminated. Okay, awesome. So we're gonna end there. And I don't know if we're gonna go right into Dr. G or we're gonna entertain questions. Peter, I'll let you make that decision, but
So what
that is my presentation.
So thank you so much, Dr. Symonette, for your presentation. I do think it was very, very informative. What I would like for anyone to do is, just in the essence of time, if you do have any questions, go ahead and place them in the chat. so that we can answer those at the end. I will go ahead and introduce our next speaker, which is Dr. Goud. And Dr. Goud has obtained his master's in orthopedic surgery from Manipal, India. Being passionate about sports drove him towards obtaining a postgraduate diploma in sports medicine from the Olympic Committee in Switzerland, and also a diploma in football medicine from FIFA. He trained in sports trauma and ligament reconstruction at Miami and Sports Trauma Research Institute in Norway. And his area of interest being minimally invasive and ultrasound guided procedures and injections, for which he trained at the National University of Singapore. He is a doping control officer, not just for us, for the Bahamas Anti-Doping Commission, but also for FIFA. And he is certified. He's a certified advanced team physician by the American College of Sports Medicine and trained for sports track side medical assistance by the International Council for Motorsport Sciences. So he is also the team physician for the Bahamas Football Association and Bahamas Cricket. And he has worked at the Rio Summer Olympics in 2016 and also the FIFA Football World Cup in Russia in 2018, along with many other major international athletic and sporting events. So Dr. Goud, you can take it away.
Thank you, Miriam, for that introduction. It was a wonderful talk by Patti. And thank you, Bahamas Anti-Doping Commission, for giving me this opportunity to speak this evening. So let me start by sharing my screen. All right, so I just want to make sure you can hear me and see my screen.
Yes, we can hear you.
Okay, all right. So this evening, we're going to keep it short and sweet because the main focus this evening was going to be on nutrition. But since we have the COVID and the pandemic going on, I'll talk a little about how we can make getting back to play in the pandemic a little more safe. So we'll get started. So right. So we all know that we've been going through this pandemic, what we short form call it as COVID-19, also known as a coronavirus disease. That's the short form as COVID-19. And the cause is the severe acute respiratory syndrome coronavirus 2. So that's what is called a SARS-CoV-2, just as a refresher. And going back into the timeline from March of last year to this year, you see that no pandemic in the history has caused such a large scale spread, and also in terms of number of cases and death. But what's interesting when we look at it is it's been mutating, and you've had multiple mutations from alpha, beta, from various regions in the world, and it's still mutating going on. They've probably reached up to theta and more. But what's interesting from the nutrition, health, and sports point of view is this particular topic where it says that people who've been active have been better in recovering from COVID-19, and inactivity is probably one of the leading causes for these athletes or even healthy individuals to have bad outcomes. So what it means in short is being physically active is so important even during the pandemic, that even if you do contact COVID, that is an important factor that will determine the outcome. No matter if you're vaccinated or your health status, being physically active is very important in this particular pandemic. So we all know that the basics of how to recognize them. There are multiple symptoms. Even though initially they started with cough, fever, chills, they've gone to every possible signs and symptoms right now, of which the most common is fever, cough, shortness of breath. And then you have a whole plethora of different symptoms like sore throat, headache, diarrhea, nausea, vomiting, joint pains, and even they've had very different atypical presentations too. But once we are aware of what to look for, it becomes easier to report and then find out and test. So coming specifically to athletes and sporting events, how do we approach this pandemic? Let's say we have an athlete on the team or an individual sport who suddenly starts developing symptoms. How best do we guide them so that we stop the spread and then make sure we give the right attention? So it's all about making sure the athlete is educated, the team coaches, the parents are all educated what to look for. And then once you find that there is a suspect, then you want to make sure that they're isolated. Even if they're not isolated, they have to be kind of giving medical attention at the earliest possible to make sure they don't deteriorate. And then you have to do testing. Now, testing varies depending on the sport, at which venue they are. We're going to talk a little more about that. So the test that we commonly use is the RT-PCR, which is considered the gold standard, even though there are antigen tests and antibodies that we test for. But the key thing that is accepted is RT-PCR test. So RT-PCR is nothing but it's a reverse transcriptase kind of a DNA testing where you isolate the RNA, convert it, and then you look for specific proteins for the SARS-CoV-2, and then if it's present, then it's indicated. Whereas an antibody test is once you've kind of acquired the disease and your body develops antibodies. So one is used to detect if you have an active infection. The second is used to see if you've developed resistance and you're recovering from the COVID. So coming to elite athletes, this is a busy slide, I know, but this is something that the British Journal of Sports Medicine has put out like as a guideline, which I think is very useful for not just the athlete, even federations to kind of have a setup of how you would like to deal with your athletes in a pandemic. So the first step is to have a group of knowledgeable, experienced people. It could be a public health authority, you could have infectious disease experts, virologists, sports medicine, nutritionists, who form a committee who would oversee the activities of either the whole of the Olympic National Olympic Committee, or you could have it for each federation. And they meet up on a regular basis to update and educate athletes and coaches to make sure that it's safe for everyone in the sporting arena. So it's important to make sure you have a chart of all the tests that you want to do, which are standardized. And I cannot reinforce the importance of hand sanitizing, face masks, and maintaining distance. As complicated as COVID sounds, if we all follow these three very simple and important steps, it would be much more easier. I mean, there are treatments, there are vaccinations, but the key is good old saying is prevention is better than cure. And so let's say you're hosting an event like a soccer tournament. And recently we traveled with the national team to Florida, and FIFA has a requirement that you do testing for athletes about 8 days, 5 days, and 3 days before the game. Each federation has their own way of working. Some of them have it as a bubble. So the importance of this is not only to find out who's COVID positive, but also to prevent transmission. Only when you find out when somebody is COVID positive can you prevent that person from spreading. And remember, these athletes they have better lung capacity, better cardiac health. So not necessarily all of them will show symptoms. So a lot of elite athletes will actually be asymptomatic, and that's where the spread can be going under the carpet. If you have someone who has symptoms, it's easy to pick it up because they're present with those symptoms of fever or cough. But if you have one member in the team who's asymptomatic and he's training with the team, he could spread it. So it's important to test before the games, during the games, and even post-game to make sure that we contain the spread, isolate, and restrict COVID-19. So once you do testing and you find an athlete has tested positive, then you retest them, isolate them, and make sure you test everyone else who's come in close contact to that athlete, especially in the last couple of days. And that's where it is very important to have a log of every person the athlete comes in contact with. Let's say they're going to training, who's dropping them, maintain a log at the training as to what time they arrive, what time they go, is there any visitor who's coming in. So in that way, you kind of restrict and you also trace back. That's why contact tracing is very important, and also testing. And in case they develop symptoms and is still negative, you have to look at other causes of why they're developing these symptoms. So it's very important to have a framework either at the federation level or at a personal level or at the national level to make sure you have things in place so that in case of a situation, you can deal with this. I'm not going to go into the details. I'm just going to talk about just about it, but I'll be happy to share the slides and it'll be recorded. So you could pause and look into the details of each of these sections later. So what happens if you are a COVID-19 positive patient or an athlete? So it's very simple. There is nothing to be worried about. It is spread by droplet and aerosol. Droplet is heavier particles, so they don't spread much further away. And aerosols are where it spreads further, but the instances where you have aerosol is much lower. So even if you isolate yourself in a well-ventilated room, even at home, just the way I've depicted in here, you could get your daily supplies. You have your own restroom, own shower, and a well-ventilated room. You should be good, and even your own family members will not be contacting COVID. There have been multiple instances where only one person has been infected. They've followed strict protocols, and then the rest of the family has been safe. So once you contact COVID-19 as an athlete, now the next step is a healthy recovery and then getting back into sports. So return to sports is a very important aspect of COVID-19 recovery. Even though you've been asymptomatic, I've seen instances, the hospital and a clinical practice where they've had a completely asymptomatic recovery from COVID, but post-COVID, they've developed multiple issues, especially more so with the cardiac and respiratory function area. So it's important that you get a medical clearance post-COVID, and then you do it in a staged manner in terms of return to play. So you got to make sure you're symptom-free for at least 7 days. Make sure you get your medical clearance, and then you start into recovery. Now, this is again a busy slide. Basically, what it's talking about is on the left is an athlete who's asymptomatic and is COVID negative. They have no problem, go back and start return to training. And then you have an athlete who's recovered from COVID with minimum symptoms. And the third section, you have an athlete who's had symptoms for longer duration. On the extreme right, you have someone who's hospitalized. So from left to right, it's the severity of the disease that you've had. And what it says is, depending on the severity, you'll have to have detailed evaluation, being cardiac, respiratory, and biochemistry, lab investigation. So the basic thing you need to get is an ECG and echo, no matter which section of the severity scale you fall under. And based on those outcomes, you might need further evaluation, or you should be cleared to play. So it's very important that even though you have asymptomatic recovery, to focus and get a medical clearance before you come into return to play. Now, this slide here is again a busy slide, but what we're going to be focusing more is the duration, the heart rate level, and the exercise allowed as a basic guideline. But again, this would vary depending on your sport, your level of competition, and your level of professional athleticism. Because as Dr. Patti mentioned, some of these sports are low demand in terms of physical endurance and aerobic capacity. So that would be different from a high endurance athlete. So on the top, it says the different stages from stage 1 to 6, wherein you allow for complete participation. And meanwhile, you go through a graded or a gradient wherein you start with walking, and then you want to make sure you monitor your heart rate and keep it below your maximal heart rate at certain percentage levels, and how much time duration you allowed for. So if you see from red to green, from left to right, everything starts to increase. So at any point and all throughout the process of recovery and return to play, you have to monitor your heart rate, your resting condition. There are multiple ways that you could monitor your stress levels. And a very important topic, which is not particularly in this slide, is the psychological health. So not just physical, psychological health recovery is also important. So having some counseling sessions is also very important in complete recovery of sport. So going into the various risk factors about which is a low risk and which is a high risk. So with the COVID, it's very important to modify your training sessions. If you can practice individually, there's nothing better than that, where you can improve on building your own skills. Let's say you're a soccer player, you could train individually, try taking your kicks, improve your strength, and do those things. So as and when you get closer to people and interact with people who are not within your zone, you're increasing your risk of getting infected. And that's what it depicts in here. So what about a sporting event? How can the federation or the event as such reduce the or decrease the risk of spread of COVID? So as you see, there are multiple ways you could do it by making a risk assessment, hygiene standards, hand washing, athlete and staff education. I think that's a very important aspect where we tend to miss out or not give as much importance as it's supposed to. Because only when somebody is educated and made to understand the process of how you can prevent it is can they be a part of it and help in prevention. So minimizing the number of persons, that's very simple for the organization, not having the spectators and having to move from, in-house spectators to more virtual and using the media, mass media, and so in that way you can reduce the risk of transmission and the location where you have the events, minimize travel and not if you don't need the team or the athlete to travel, try and minimize that as well. And testing and contact tracing are probably the most important things I would say to kind of mitigate or put a stop or put some brakes on where you can spread it further, because that's the only way you can know who's positive and who they've come into contact. And when you talk about contact tracing, they talk about something as a high risk contact or a close contact. Well, by definition, they say someone who's been in close contact is less than a meter or less than 6 feet for more than 15 minutes without a mask on, who is tested positive or a confirmed case. Well, that's a general statement that you put out for saying who is a close contact. But when it comes to sports, you know that you're always in high intensity levels. So your heart rate, your breathing, you're breathing with much higher intensity. So that really doesn't hold good for sports. It's actually much more intense. And we'll come to a slide soon on that as to how you can again kind of assess the risk, whether it's low risk, intermediate risk, or high risk. So if there's one slide that you need to take back home from this talk, it's this for athletes about where you train, the location, the proximity, and the time. So the location, the more you train indoors, the more riskier it is. The more you're in outdoors, the safer it is. Proximity to people. So if you have to do, let's say you have weights or equipment that you need to use in the gym. So you could, most of the gyms these days have an outdoor workout area too. So you can always carry your training equipment outdoors and train outdoors rather than doing weights indoors, like free weights or resistance training or plyometrics. So try and do things outdoor, try and keep a safe distance, and the minimum time you spend indoors and close to people, the safer it is for you. So this is what I was talking about specifically to sports. Now they've gone further into details in terms of the close contact rather than just putting a 1 meter proximity for more than 15 minutes. They've gone into further details of whether the contact is face to face or that the interaction is constant or it's fleeting. And that's how you can put it as a low risk, moderate, or an increased risk. So let's say you're in a proximity of 1 to 0 meters, which is within 1 meter, and you're face to face in contact. Let's say it's a soccer game where you're a defender and the striker of the opponent team is coming close to you. So it's whether you're spending more than 3 seconds close to him face to face, and over a period of time in the whole game, if you're close to him outdoors more than 15 minutes, that's a moderate risk, going on to increased risk. So even though we put a blanket statement saying that a close contact is someone for 15 minutes or more, when it comes to sports, it's further in detail and it's much more complicated than that. But the basic thing you got to remember is try and stay as far as you can and wear your mask. But of course, in competition, it's not practical to wear masks and do that. That's where in the federations and the tournament officials do these testings of games on a day or two before, 3 days before, 5 days, and 8 days. In fact, on a recent tour with one of the soccer teams, they had an issue where they had to cancel a game because even though they did 2 testings on day 5 and day 8 before the game, they were all negative. 2 days before the game, they retested the whole team and they found there were a lot of positive cases, so they had to cancel the game. So that's where testing is important. Otherwise, what would have happened is in the game that would have been in close contact, and that would have just caused a disaster for the whole tournament. So in those terms, it's important for the federations at the higher level to understand what is the risk involved and why testing is so important. So this is again talking about in detail about volume. Let's say when you talk about indoor, what is a space that's in there, whether it's a high ceiling, low ceiling, what is the air velocity. This is more in technicality about how many windows are present, is there good ventilation, how many people are in there. So all of these factors are very important when you determine whether it's environment that's at high risk for transmission of COVID, or it's a relatively safe zone. But coming to what you can do as an athlete at your own level, it's very simple and basic. Bring your own equipment, choose to train outdoor. You prefer to train in a larger play area, limit travel in public transport. I know sometimes in certain areas it can be challenging, but this is the time where we have to try and focus and put a little more effort in complying with these things so that the outcome is better. Because if you're a team member and if you are the one who is not following and not being compliant, you could risk your whole team getting COVID if you don't follow these protocols. So if you're training indoors these days, you have HEPA filters, which kind of filter out the virus too, and limit interactions in person. So if you have to have any interaction, be it your, even if your support staff, if it's something you don't have to be physically present, you could always still have a phone conversation or a video call and then have those kind of consultations so that you limit interactions in person. And always carry extra masks, because you never know, you could be told that you were in close contact with someone who was COVID positive, so you can't reuse a mask. So carry extra masks, extra and enough hand sanitizers. And even at sporting venues, let's say it's a training session, the federation would have enough water and soap for hand wash, hand sanitizer, have a log, temperature checks every time they come in for training so that you can rule out those signs and symptoms. You ask a questionnaire, whether how they're feeling, do they feel different, any weakness. Try and find out all of those things when they come into training so you can reduce and the risk of transmission. And focus on building individual skills. So only if needed can the team practice together. Let's say you're a tennis player, you could do your own individual practice, but if you have to play a doubles game just before the games or where it is very important, that's when the team comes together. If not, try and practice as individually as possible, and avoid handshakes or high fives or any of those kind of things in training or encouragement. And even instead of, if you have someone who's the coach or anyone who's kind of wanting to applaud rather than shouting out saying, you could always clap or other ways of communication so that you reduce the risk of transmission. Now, FIFA and football have kind of put out these specific goals that they're like a flow chart, which I talked about earlier. The federation level is to have a risk assessment, plan ahead of time, engage and educate, enhance hygiene measures, monitor and testing, and review and collaborate. So these are the key kind of points that any sporting event or an athlete can follow so that you could understand the process and reduce the risk. And they have this formation of 4-4-2 just to make it look like a soccer team, wherein you have self-isolation if you have symptoms, which are the most common 3 ones. Do not share drinks, have your own specific drinks. Maintain social distancing, hand wash as often as you can for 20 seconds, clean surfaces and equipment after use if you have to share it, practice good respiratory and sneezing and cough etiquettes, wear PPE wherever essential, do not spit or at the soccer field or the training area to mitigate the risk, and minimize use of shared equipment and dispose of tissues or things that you use in a specific place. So you kind of, or the contaminated waste can be going in a particular area. So coming back to how can you prevent it? Well, this is again a no-brainer. We've always talked about exercise as medicine. We've been prescribing exercises in general to kind of improve health, even in people with diabetes, hypertension, and it's no different in COVID times. And what they found is during COVID times, the physical activity level actually came down by 33%, and your sitting time actually increased by 28%. So the inactivity actually increased during the pandemic, and that is what is leading to bad outcomes in athletes and general population when it comes to recovery if they've have COVID. So there are various ways in which you can have physical activities. You could have informal activities like doing your own chores at home, cleaning the yard, doing laundry, walking up and down the stairs, or you could do formal exercises by using apps, watching videos, following things on YouTube, or you could go to the outdoors and do cycling, jogging, swimming. And so there are various ways you could do that. And the recommended is at least 30 minutes of exercise every day for 5 days in a week. And that should be the bare minimum. But when it comes to athletes, you know, you have to train much harder. So this is a basic baseline of what you should be doing so that you don't become inactive and maintain the equilibrium. So a lot of sporting federations are putting out these brochures out and encouraging general population and athletes to stay fit so that they don't be inactive and put on risks for COVID. So coming back to the Olympic Games, which is a hot topic, and we just about less than a week away from the opening ceremony. The Olympic Committee has a medical committee as well, and they have put out this thing called the playbook, which is accessible to everyone online as a e-copy for athletes and official, which walks through the various stages leading to the games as to what you need to do and what you need to follow. I would encourage everyone to have a look at it. It's in detail, but I've just taken a few screenshots from that so I could share it in here. So they're also kind of stressing on the fact about wearing masks. There is no replacement for that, because the only way you could prevent others from getting is wearing a mask. And if you do that, that would reduce the risk of spread significantly. And as we spoke earlier, they're talking about keeping physical distance, avoid physical contact, keeping distance, avoid crowded places. And specifically to the Olympics, they have transportation, they have multiple apps as to, and they have a whole itinerary for these athletes before even they go in as to where they can train, where they can eat, and all of that. So once you follow all of these protocols, they should be safe in there. So specifically for the Tokyo Games, they have developed a lot of apps, and you have to upload your test results and your whereabouts, including a lot of these GPS tracking, so that they can monitor and then find out. In fact, I was reading an article wherein they have this app where everyone's supposed to have it in the Olympic Village. So you have it on, and if someone is a suspect, it shows up so that you can maintain distance. And there's a lot of technology being used during the Olympic Games to make sure it's going to be as safe as possible. So think hygiene, wear the mask, wash your hands, support your athletes by clapping instead of singing or chanting. So, you know, when you sing and shout, you are going to cause aerosolization compared to just droplets. So it's going to be a quiet Olympics this time with just a few claps, but that's how, that's the need of the hour. And then when you're in rooms, try and ventilate, keep the doors and windows open so you have fresh air flowing in, and as much as possible disinfect the shared items and keep them clean, and if possible use your own. So this is just like a story about how athletes would be going into the Olympics. So a Spanish basketball player has to get his COVID test done. The 2 COVID tests have to be done before they leave or fly, and those results have to be uploaded onto the app. And once they travel and when they land at the immigration and in Tokyo, they're supposed to present these pre-approved test results, and then they have specific transportation that takes them to the Olympic Village, and then they're there. And let's say you're in the village, and during the training sessions, what they're doing is actually testing throughout during the stay in there. So let's say you're an asymptomatic person and you test positive, it shows up on your app, and then you're retested, and then you're isolated, and they have a COVID center in there. Specifically at the right bottom, you see that for athletes who test positive during the Olympic Games, they're going to have separate facility for them. And then they're going to do contact tracing of the previous people they've interacted with and make sure they tested for COVID as well. And once they're COVID negative, let them participate back in the sport. So there's a lot going on in terms of how they're going to manage the Olympics. So I would recommend all the athletes to download the ebook and go through it, so you have an understanding about what happens at the Olympic level and how they're taking care of things. So again, when you leave, they expect you to do the COVID results and make sure you're negative, and then you're back to your country. So this is how they have the governance structure at the Tokyo Olympics. They have the IOC, they have the public health authorities, and the infectious disease specialists there. They're all going to be working, and they have something called as a CLO, who's a COVID licensing officer, and each country has a COVID licensing officer who's based in Tokyo, who's been interacting with them months ahead of the games, giving them instructions, following the results, having the list of participants, when they arrive, when they leave, where they're going, and if they need to be tested. So you have had licensing officers or TLOs earlier, but now specifically because of the pandemic, they have one taking care of COVID requirements for the Olympics. So coming to the sport risk levels, as we all know, there are certain sports which are low risk, moderate risk, and high risk. It's basically purely based on the contact, duration, and intensity where you come in close contact with people. So to summarize it, the 3 C's to avoid is crowded places, close contact, and confined spaces. And the more you overlap all of these, the higher the risk it is. And there is no replacement for wearing a mask, cleaning your hands, making sure you have your own equipment. So that is what is going to keep you safe. And this is something I just put out there because a lot of things get circulated on social media and texting applications. So you got to make sure you read the right facts, verify them, rather than ask your physician, ask your team doctor, ask your coach, or ask your federation what needs to be done, how you can approach it. So it's important to get the right information from the right place, so you don't just spread another, they have a particular name for this, I forgot, like a pandemic text or something. Anyway, so that's pretty much what I wanted to talk. My references are mostly from the IOC Medical Committee and the British Journal of Sports Medicine. And thank you. So we'll try and maintain 6 feet distance, but not in a way that you can't play these sports. So if you have any questions, I'll be happy to answer them.
So thank you, Dr. Goud, for your wonderful presentation. Does anyone have any questions either for Dr. Goud or Dr. Symonette? There weren't any questions in the chat, so I do want to give you guys an opportunity to ask them now. And if not, let's see, any questions? No, okay. So thank you all for joining us tonight. We will be posting this on our Facebook page and also on our website. So you can, you'll be able to share the link on Facebook with any of your friends or colleagues or athletes. And we will be doing this series. We'll try to do it monthly. So look out for any messages from us either via email or on our Facebook page or website for the next and up and coming Zoom class. So thank you so much, everybody, for coming. Good night.
Thank you, everyone. Good night.